Welcome back, welcome back. I'm so happy to be back. And I have put together this very unique and special show because so many of us experience problems with this part of our health and really don't know how to work our way through it. We don't know the questions to ask. We don't know what we're looking for. So I've invited two people to one of our guests is Glenn Brooks of vitalityliving.com, and he has assisted me and directed me in this direction of a better understanding. And what I'm really talking about is dentistry. Most of us understand we need help there. Most of us understand we need continuing care. But where do we go? I mean, so many of us are walking around with these toxic releasing mercury amalgams in our teeth, and yet where do we go to get them removed appropriately? What do we do that can enhance our oral health? So, Glenn, welcome.
Thank you, Corrine. It's, by the way, it's vibrant living connections. Just so that people know where I share a lot of my resources, including I have my own radio network, which you're a part of, and it's an honor being here today. And I just want to say, and I'm sure many people are going to relate, my first dental experience was unpleasant, intrusive. I think I recovered after the dentist going to see Laurel and Hardy movies, but it was very unpleasant. In my teens, when I started to change my diet, and realized that what I was eating was causing me problems. And, I was following the tradition of my father who took medication for his sinuses. I started to get really curious about the dentist because the dentist always seemed, it was one of the outside doctors that you saw. It wasn't in a continuum of the other doctors. And somehow, because of my pain and discomfort and fear of the dentist, I started to wonder if there was a better way. And if other dentists had a concern, I picked up a book called Money by the Mouthful, written by a dentist, and I started to say, hey, there's a different world out there. Now, approximately 7 years ago, I became very friendly with Dr. Nicholas Gonzalez. Some of you might know Dr. Gonzalez. He was a pretty renowned oncologist, world-renowned for his work with pancreatic cancer. He called me up before we did an ongoing series. And he said, Glenn, what's your take on all this stuff with holistic dentistry? And I said, well, they call it holistic, but certainly things I've heard and experienced could be possibly very invasive. And from that, and from my experience, and a lot of people say that, so there was a lot of fear-mongering, but the bottom line was, the thing I cared about the most is what makes dentistry minimally invasive so you could actually save teeth. It was done in a way that respected the whole body, the tongue, the mouth, and was based on nature's principles, the principles that inherently within the body, there's an inherent wisdom. So when I first heard about biomimetic dentistry, it was through Dr. Gonzalez, and he called me up one day. He said, you got to speak to Dr. Saul Pressner, and I did. And I had people on from around the world. I had many of the leading holistic dentists on, and I just felt, based on that first conversation, interacting with Saul and some of his colleagues, that this was the kind of dentistry that was honoring and respectful of the person. It was based on the latest science and totally missing from all the invasive stuff that I was encountering both in the holistic realm, the majority, and a lot of the people doing cosmetic. So to me, it was the missing piece, and I'm learning about it. And I'm here today with Dr. Saul Pressner to touch people, to educate them so they know what questions to ask, and they can have a different take on this costly work.
So welcome, Dr. Pressner. Thank you so much for coming to us and to give us a new eye into this area of our health. So what is biomimetic?
Thank you, Corinne, and thank you, Glenn.
You're welcome.
Thank you. Biomimetic dentistry is basically bio meaning life and mimicking life. And we try to preserve as much tooth structure as possible and we try to restore the tooth to its natural state before it had been destroyed or damaged by bacteria, by clenching and grinding. And we use materials that are biologically compatible. We try to seal out bacteria so that there is less likelihood of breakdown of the fillings and restorations over time. And we have the concept of we repair teeth, and we try to avoid catastrophic failure. A lot of dentists, most dentists who are educated in the United States and throughout the world, and I could speak for myself as being included in that group, were taught that when part of a tooth breaks, we're taught to file the rest of the tooth down for a crown or a cap. And oftentimes when you do that, you endanger the nerve of the tooth, and the tooth needs root canal therapy. And we were taught by doing a crown, we're protecting the tooth from further fracture. But with new adhesive technology and new science, we have materials and methods that can rebuild teeth without filing as much tooth structure down. And there is less risk of the tooth needing root canal therapy, and then therefore less risk of catastrophic failure of that tooth. When you do a crown and when you do a post and a root canal and post, the tooth is much more fragile to catastrophic fracture. And when a tooth fractures vertically, oftentimes the tooth has to be extracted and the tooth has to be replaced with an implant. So by doing biomimetic dentistry and following these protocols, we're able to preserve more tooth structure, and we often can preserve the vitality of teeth. And if another piece of the tooth breaks or if the filling needs to be repaired, we simply can repair it, and the tooth is still in the patient's mouth, and often the vitality of the tooth is maintained, and you can maintain that tooth in your mouth for a longer period of time without it being lost.
No.
So that's it in a nutshell.
Now, when I remember going to the dentist and the dental work that I've seen, when the patient walks in, if they have a cavity, they dig very deeply around this cavity, removing all remnants of bacteria, but also a brown discoloration. And so even a small cavity creates a very large cavitation. And then inserted in there, and still to this day, is what they call amalgam or composite. And an amalgam is, what is that, 45 to 60% mercury with other binding metals?
Other metals, correct, yes, right. Yes.
And then when you chew on something hot or eat something cold, the metal expands or constricts, which creates more of a breakage. And now you're into this cycle of this very deep broken tooth. So how does Biomimetic work with this? And also one other quick question that can be included in this is, there's such a thing as remineralization. Is that really possible after a cavitation?
If I could just step in and say one thing, because Saul just said something that was so significant, because it cuts to the heart of why so many people seek out different kinds of dentistry. Well, the thing is that if you look at most dentistry, Corinne and Saul, biomimetic dentistry, its focus is not to have the word breakdown, or as an example, start treatment that's invasive, like crowns and root canal. Like its whole premise is to treat the body with honor and respect, and to do things by the laws of nature. So, in a sense, what you're talking about, Corinne, is this idea that you go to the dentist, and what people are used to is a lot of invasion. They're used to, like, I had the honor of talking with Dr. Matt, another biomimetic dentist, and he was telling me this patient came in, several dentists, leading dentists in L.A., said this tooth needed to be gone. So you see, when you start to be invasive with the mouth, you set it up for all these other secondary concerns. And this is why I feel this is what's really brilliant about biomimetic dentistry. It honors and respects the inherent brilliance and wonder of nature and works with that rather than, oh, this mouth needs crowns and it's got to look all pretty. So I just think that what Sal said was so significant.
Thanks, Glenn. And just to answer your questions, Corinne, when you have a cavity, you do have to remove the diseased tooth structure that has been broken down by bacteria. But in biomimetic dentistry, we use something called caries indicator, which shows us if there is any remaining infected dentin that needs to be removed. But there is also something called affected dentin, which is a deeper layer of dentin that does not usually have to be removed. So with biomimetic dentistry, by being more specific in our caries excavation, we don't remove as much tooth structure as conventional dentists do. So we preserve more of the healthy tooth structure. And you do see some stained dentin, which is the dentin is the layer underneath the enamel. But with biomimetic dentistry, we are able to preserve more of the healthy tooth structure. And we do restore teeth. I don't personally use amalgam anymore because it has mercury in it, and amalgam fillings, which contain mercury and metals, do correctly, as you said, expand and contract at a different rate than the rest of the tooth does, which causes fractures, even microfractures within the surrounding tooth structure. And many dentists have seen and patients have seen that teeth that have had long-standing amalgam restorations do fracture because of the differences in coefficient of thermal expansion of amalgam versus tooth structure. Composite, when used properly in a biomimetic fashion with proper bonding techniques, has a similar coefficient of thermal expansion as the surrounding tooth structure, so we find less fracturing of the tooth when we restore teeth properly using a biomimetic technique with composite. We also sometimes use porcelain. I sometimes do use gold on back teeth, although patients don't want metal in their mouths a lot of times. But gold is still considered a very biologically viable material if it's very pure on back teeth.
And it's soft too, isn't it?
Say that again?
It's soft also.
It actually is of a similar hardness to tooth structure. Porcelain and zirconia are much harder than gold. So what people find actually, and what dentists find, is that in teeth that have been restored with porcelains, certain porcelains and zirconia, the opposing teeth wear at a much greater rate than they do when they're opposed by gold or composite. So it depends. If you have a patient that's a clencher or a grinder particularly, or even not, the opposing teeth opposing porcelains and zirconia can wear quite a bit. So you have to be very careful with the materials that you select when you're a dentist and talk to the patient about the advantages and disadvantages of each material. And that's what I do. I give patients options and tell them what the pros and the cons are of every procedure that I can perform.
Now, how does the American Dental Association relate to biomimetic dentistry? Because they're still supporting amalgam usage. You know, in Germany,
Right.
it's against the law to put amalgam into pregnant
correct.
women. It's against the law to put amalgam into children up to 18 years old. And yet the American Dental Association supports that practice. So how do they relate to you and your group of dentists who are, you know, I just looked in preparing for this, I saw there's a big training center in biomimetic dentistry at University of Southern California where I went to school and to graduate school.
And yes, it is. That's correct. I've trained in LA with some of those people. Yes, the American Dental Association, you know, unfortunately,
is a dinosaur.
It's an education process, and The American Dental Association, I think their mission is to try to help patients, but the research doesn't always filter down to the dental schools and the American Dental Association that quickly. So the representatives of the biomimetic movement have been trying to lobby the American Dental Association to change certain codes to allow for biomimetic dental procedures to be more readily reimbursed by insurance companies. They're working on it. It's a work in progress. I can't speak for the policies of the American Dental Association. I am a member of the American Dental Association, but I can't speak as to why, as to what their policies are in terms of amalgam, because I'm not in the powers that be. I can only tell you what the research says in terms of amalgams do expand and contract at a different rate than the surrounding tooth structure and are more likely to cause the surrounding tooth structure to fracture. So I don't use it anymore. And the restorations that I use are more in harmony with the rest of the surrounding tooth structure. And hopefully the research will show the powers that be that this is a better way to treat patients.
Now, I just went to the dentist with my son, and he's young. At the time we went, he was 5 years old, and he had perfect teeth, which I expected. And then they said, they wanted to do a fluoride wash, which fluoride is a neurotoxin, and they wanted to do a fluoride wash on his teeth and wanted to make sure he was brushing his teeth every night with fluoride. And then they recommended that he have his teeth ground down and a resin placed over the teeth to protect them.
A sealant. But actually, Corinne, they don't grind the teeth down when they place a sealant. A Pitt and Fisher sealant is a procedure that does prevent biting surface decay in children, and they can last a long time. And that's both fluorides and the use of sealants have decreased the incidence of dental decay in our younger population. Science does show that. I'm not a physician, so I really can't comment on the toxicity of fluoride, unfortunately. I'm a dentist, and I just know that based upon the dental research, fluorides and sealants have been helpful in reducing caries rates in young people. But with sealants, there is no filing of the teeth at all. We do place a conditioning solution on the enamel to allow the sealant to adhere.
Doesn't it irritate or roughen the enamel so that it adheres, almost like a light sandpaper?
It's a slight roughening of the enamel, maybe one very, very, very slight, but that is covered over with the sealant material. Mm-hmm. And the literature, I actually, in my practice, I don't seal every upper and lower molar on my children, on my patients who are children. It depends on the depth of the groove. If the groove is not that deep and there doesn't seem to be a plaque trap for the plaque to accumulate and cause a cavity, I will not routinely seal those teeth. I will monitor them. But if there's a very deep fissure, the literature does show that placing a sealant on those teeth will prevent, if you do it in a very competent manner, will prevent occlusal caries from occurring. And that's a good service for a patient, in my opinion. But I don't feel that every tooth needs a sealant.
Mm-hmm. So for my listeners who are really looking for a dentist that they can communicate with and also understand some level of the toxicities of what's being put into their mouths and wants to avoid that level of toxicity, how would my listeners go about to choose a dentist? Where would you recommend that they go? That's
a good question. Well, I'm not I'm not a holistic, quote unquote, holistic dentist because I don't really know what that means.
No one does, though.
I would say that I'm an ethical dentist, and I basically
Sometimes
use
that's hard to
materials
find.
that are approved by the American Dental Association as being safe. However, one may argue that amalgam may not be safe. I don't place amalgams. But I think you have to look for a dentist who has taken a lot of continuing education. I think members of the Academy of General Dentistry who are either fellows or masters of the Academy of General Dentistry are a good bet, usually because the Academy of General Dentistry requires that dentists take a certain amount of continuing education each year and have to pass certain exams. So, most dentists who are at that level are pretty competent. I would ask for referrals from friends and family of people who are satisfied with their dentist. The Academy of Biomimetic Dentistry, of which I'm president, I think our members, for the most part of those I know, are very ethical, and we try to do the right thing for our patients. We try to explain the alternative treatments that are available, the advantages and disadvantages of each treatment. I know I do. And what the long-term prognoses are for each therapy that we use. In terms of toxicity, I am not an expert on toxicity of materials. I really go by my gurus, who are Dr. David Alleman, Dr. Ray Bertolotti, Dr. Simone Della Peri, and these people are all innovators and pioneers in adhesion dentistry and biomimetic dentistry, and they do try to use safe materials. I try to use a rubber dam whenever I can when I place restorations so that there is very little exposure to the patient of the materials. And when I'm removing amalgam, if I have to remove an amalgam from a patient, I will use a rubber dam and high-speed suction and oxygen over the patient's nose so that there is minimal exposure systemically to the mercury vapors to that patient. So I guess I would, if let's say a patient wanted to have their amalgams removed for whatever reason, I actually don't recommend removing amalgams unless there's a real reason and a need, because the less time a tooth is operated on in one's lifetime, the better it is for that tooth. However, if one does want to have their amalgams removed and one is concerned about it, when one is discussing this with the dentist or even before the appointment and one wants to talk to them on the phone, I would make sure they use a rubber dam, make sure that they use high-speed suction, and have an oxygen mask over the patient's nose so that it's done as safely as possible.
I just want to comment. Glenn Brooks, Vibrant Living here. I've had a chance to have dentists on from all around the world on my show. So my comment about the holistic dentist thing is that there's no set standard. But if we listen to what Saul's saying, we listen to biomimetic dentistry standards. So I'll give you an example. In holistic dentistry, there's a lot of, and I discussed this with when Dr. Nicholas Gonzalez was alive, because his teacher was a dentist. He went to Dr. William Kelly, and Kelly made a comment about this, because Kelly was having tremendous success in some patients with cancer by changing diet and doing detoxification. And Kelly's response when they spoke about dentistry to Nick was, don't invade the body unnecessarily. So I think in people's vigor and the fear-mongering around amalgams, it's a legitimate concern, but I think for a lot of people it's overwhelmed their immune system getting out the fillings. Right. The second thing I comment on is that, and I know several holistic dentists who promote this notion of cavitations or hidden infection. I've had the chance to speak to doctors who have had dentists attempt to remove these cavitations, hidden source of infection, and many of them got ill or were stressed tremendously by, funny enough, extremely invasive procedures. So my thing about, if we call ourselves a holistic dentist, we got to be honoring and minimally invasive, and also have some soul in caring for the patient. That's inherent. And the concern I have, Corinne and Saul, is that some of the dentists that perpetuate some of the invasive treatments of so-called holistic dentistry is they're invasive. So I love the idea of starting by minimally invasive, educating the client, having them, if they need to, work with a nutritionist. I think the idea that you need to get these radical invasive procedures, I don't, in my experience of being a journalist 30 years and talking to dentists and exploring this, and also people who have been really hurt by dentists, is it's too invasive, including some of the cosmetic procedures. So that's my take on that.
Agreed. Less
So
is more.
we're going to take a quick break right here. This is Take Charge of Your Health. We're speaking with Glenn Brooks of the Vibrant Living Connections and Dr. Saul Pressner, dentist and president of the Academy of the Biomimetic Dentistry. And this is Take Charge of Your Health. And we'll be right back. Welcome back. This is Take Charge of Your Health, and I'm speaking with Glenn Brooks of Vibrant Living Connections, who is my co-host for today. I'm really having fun today in this conversation. And Dr. Saul Pressner, dentist and president of the Academy of Biomimetic Dentistry. And I brought this before us, and so important because so many of us feel so powerless in relating to our dental health. We have very little understanding of it. We really don't know what to trust or what to focus on. And Dr. Saul Pressner is here to help us kind of sort through this maze that we have to go through to get appropriate dental health. But there's one other piece of the puzzle, and this is a biggie, is the cost. When you go in and there's a small decay and then it's dug out, now it's a big cavitation, and they put an amalgam in there that shrinks, and now you have it cracked. Now it needs to be treated again, and then if it can't hold, then we go into crowns and the whole thing is ground down. Dr. Pressner, how does your method of working with teeth hopefully prevent this whole cycle that really ends up in loss of the tooth and a root canal?
Yep, and potentially the loss of the tooth. So what I recommend, there's something that Dr. Pascal Magnier and Dr. Matt Najad, who you referred to University of Southern California earlier in your talk about. It's called the cycle of tooth death, and when I give lectures to other dentists, I show this video that it basically the treatment starts out with a very small cavity, as you just mentioned, and traditional dentists place an amalgam. The amalgam, as you mentioned, Corinne, expands and contracts at a different rate than the rest of the tooth, and part of the tooth cracks. And then these dentists are taught to place a crown and do a root canal with a cast post. And they do that, and then what happens over time is, because you've removed a lot of the viable tooth structure by doing a crown and a post and a root canal, the tooth can crack vertically and the tooth is lost, and then an implant is placed, if it can be placed. And that's called the cycle of tooth death. So with biomimetic dentistry, we try to avoid that whole cycle. We use something called air abrasion very often, which it targets the cavity. So we remove less of the viable tooth structure by using a powder under pressure to remove the decay, along with hand instruments. So there's less vibration and there's less removal of tooth structure. And as I mentioned earlier, we try to avoid a catastrophic failure of the tooth. A catastrophic failure means that the tooth has to be extracted. And by being minimally invasive and removing as little tooth structure as possible and using caries detector so that we can target and pinpoint just the amount of tooth structure that needs to be removed, and then we restore it with biomimetic techniques which bond very well to the adjacent healthy tooth structure and prevent bacterial contamination and invasion over time, we're able to preserve more healthy tooth structure, and the tooth is usually able to survive in the mouth for much longer periods of time. If something does chip, if part of the tooth chips or part of the filling chips, with a biomimetic restoration, we can easily repair it. But the bottom line is the patient still has the tooth. He or she has not lost the tooth due to a catastrophic failure, which can occur from over-treatment and overly aggressive treatment. And look, I don't blame dentists. This is the way we were educated. But this is a new paradigm, and to be minimally invasive is better for the patient, and from a cost-benefit ratio, it's much less expensive usually to do these treatments. One of my colleagues in the biomimetic dentistry movement calculated that a single tooth, if you have performed a crown, a root canal, a post, and then an implant, that can cost up to $10,000 or even more with a bone graft. But if you do a biomimetic restoration, it's much less costly, and you can save the tooth. So what's a tooth worth? I mean, it's worth it to me to spend a little more time and carefully excavate the decay in a minimally invasive way and remove only the diseased part of the tooth and restore that part of the tooth more conservatively so that the patient is able to maintain that tooth in their mouth longer. And baby boomers are living longer. We're all living longer, thank God. And we want to hold on to our natural teeth as long as possible. And if we hold on to our natural teeth as long as possible, we can chew better and we can have a better smile. And it's better for our overall health. There have been a lot of studies linking good oral health to good overall health. And by maintaining our teeth in a healthy manner and removing as little tooth structure as possible, I feel that this contributes to our well-being long-term.
Glenn?
So I hope I answered.
Oh, perfectly. Thank you so much. Glenn?
Sure.
Well, I was just thinking that, there was a book by Alan Nittler, I think, called The New Breed of Physician. I think the new breed of dentist is going to look at all these. They're going to look at things and go beyond what's been their schooling. They're going to care about, there's no question, I think, with Saul, there's a compassion, there's an understanding. I think you want to look who's behind the dentist as a human being. Do they really care, or are they just banging out numbers that fits the dental office, right? You go to an upscale office, which is fine if it's upscale, but you also want to know that they're looking at you as a human being. A friend of mine, someone I know, flies to see Saul from Florida because he says this kind of work is not available in where he lives in Florida, and it's cost him a lot less money. So I think the caring and soul of the practitioner, the mindset that you're there for the patient and do the least harm is profoundly relevant, not just economically, but for the soul, the caring of the... I mean, this is one of the things I used to discuss with Dr. Nicholas Gonzalez, was that, and one of the things that Nick said to me, which I think is true in dentistry, is he used to say that a lot of people die when the oncologist claims they have cancer. A lot of people die when the dentist says, we got to redo all your teeth. Every tooth's got to look like a horse tooth. Every tooth's got to have a certain look. So you got to make a discernment. The discernment is it cosmetic, or could it be cosmetic and useful and healthy for the whole mouth? So you got to. Unfortunately, none of us have these. None of us are educated. And most dental offices, when you ask them a legitimate question, a lot of times they don't know how to answer it, or they say something that, we want your teeth, or we cater to cowards. Right? What do they say? What do they say?
Yeah. The bottom line, what you're saying, Glenn, and I think, is that we were taught, we took the Hippocratic Oath.
Mm-hmm.
We're to do no harm. And unfortunately, a lot of dental treatment that is done, because it's overly aggressive, does do harm, unfortunately. I don't think it's deliberate, but I think there's a better way of being more tooth-preserving and try to be kinder to the tooth and to the patient. So,
well, there is a response. You know what? First, do no harm. I'm going to be a little devil's advocate. There is a responsibility, and the responsibility, you have taken that up. The responsibility is of the practitioners to find the best way for the health of the patient, for the health of the teeth.
Yes.
And those people who are not seeking any long, I graduated, I got my degree, those people can sit there and say, I didn't mean to hurt you. I'm so sorry. But that doesn't help at that point. What we really need, yes, it's a very nice person. It's important to a degree that it's a very nice person, but we need someone who's questioning and looking and working toward the health of the patient. And in your case,
Absolutely.
it's specifically the dental health of the patient. I do feel very strongly about those who have not looked at the amalgam issue and are still inserting neurotoxins into people's mouths when governments all over the world are banning it. I think
I agree.
that's
How many people
that's
have panic
irresponsible.
attacks? How many people have panic attacks? Last time I went to the dentist, it wasn't Saul. I went to a regular dentist. I kind of forgot that I'm highly sensitive to epinephrine. That's in a lot of the Novocaine type solutions. I had terrible anxiety for an hour and a half. See, when you go to an office, part of what you're counting on the wisdom and the integrity of the dentist to say to you, like, as an example, have you had a bad response to Novocaine? A lot of people listening, they're highly sensitive. They need to be paid attention to, and their procedures got to be able to match them. So, as an example, if you do too much dental work, the person could be suffering for months with neck pain or jaw discomfort. This is why I like this approach, because the inherent in the approach is you're not jolting and you're not working on a dental schedule purely to move to the next patient to get a procedure done. I think the audience, I encourage you to pay attention. Look at people when they leave the office. Do they seem strained? Like, pay attention to the wheel that you're going into. You want to be able to go to a low-key practice and feel honored, and that your questions and your concerns, your nutrition, your lifestyles is taken into account. And I happen to like it as an example that Saul does certain practices that take care of him. He does relaxation and meditation practices. When your surgeon comes into the room, you want to know that person's healthy. They have a peace of mind. They're not trying to make another $10,000. That's obviously a big factor. As a consumer advocate, I'm really concerned that a lot of times, I know a guy in New York City paid $150,000 to get his mouth done over. The next 2 years, he was in chronic discomfort. So we got to. It's hard because none of us are educated in this. The questions you're asking are brilliant, Corinne, and a lot of people don't know what to do because we're educated. The advertising for dentistry is kind of ridiculous. It doesn't really mention what's relevant. What's always going to be relevant is non-invasiveness, that the patients looked at in terms of how they could heal and deal with the treatment, and what's honoring to the whole body through the procedure that's done in their mouth.
Dr. Pressner.
And the cost.
And Corinne, what you were saying about placing amalgams, yes, I mean, I think that I do not place them. I've not placed them in many, many years, and there's a better way.
Mm-hmm. I dove right in there, put you right on the spot, didn't I?
Say that again?
I dove right in there and put you right on the spot, didn't I?
Well, I don't mind because I don't place them, so I'm at peace with that.
So I want to thank you so much. It was a wonderful, informative talk. I know that we've all learned. I know I have.
I have.
And
Thank you.
Yes, and we're speaking with Dr. Saul Pressner, dentist and president of the American Biomimetic Dentistry. Now, I don't know if the beginning, biomimetic, bio means life, mimetic means matching or mimicking.
Yeah, mimicking life. It's the Academy of Biomimetic Dentistry.
And that's a pretty beautiful title.
Yeah, thank you.
Yeah, I think so.
So can you please give us your website and your phone number?
Sure.
And ways that we can contact you?
Sure. My phone number is 212-249-8999.
Could you repeat that, please?
Sure. 212-249-8999. My website is www. No, I have to look it up. I forgot. I'm embarrassed.
When we type your name in, Dr. Saul Pressner, Pressner, it comes right up. Dentist.
It comes right up. Sorry. Oh, yeah, I remember it now. www.newyork-cosmeticdentist.com. And it's an old web domain name because I do cosmetic dentistry, but I'm mainly a biomimetic dentist. That's why, subconsciously I probably forgot what the web domain was, because it's really not relevant to me anymore.
Now,
and if people, anyway, but
Go
you
on.
can call me at my phone number, and so it's my website is www.newyork-cosmeticdentist.com.
Now, is there anything else you want to share with us that we might have missed? Something you want to leave the audience with?
Yeah, I would say that whoever you go to as a dentist, I think that they should offer you options, and I think it's very important for patients to feel empowered in the dental chair, because when you're in the dental chair, you're in a position of vulnerability.
Very much.
And
so.
I think that the playing field has to be level. The dentist is the expert. However, you're receiving the treatment, and you have a right to question the dentist in terms of what materials he wants to use, and you have a right to ask what options are available for your various dental issues that are present. And you have a right to question. Doctors are not gods, and doctors need to be continually educated. I know that I do, and I learn something new every day, and I think that you should have an open line of communication with your dentist about any issues that are of concern to you. That would be what I would leave you with.
Thank you. Glenn, what would you like to leave the audience with?
I think
and I need your website.
Vibrant Living Connections. Vibrant Living Connections. I also developed the Integrity and Real Food Award, Yeah, I think keep inquiring, keep what Saul just said. I think that to be educated, to be a lot of times that you might leave the office and feel your only option is $10,000 treatment, or you need crowns, and it's a lot of times it can be a simple procedure that is less expensive, less invasive. That's really good for you.
I was in a front office where one woman said, I would rather have bought a BMW cash with the money I'm giving my dentist.
Yes.
Right.
Yeah, no, it's a huge expense, and I think I encourage, listen, I had a woman calling me from New York, and she said, the dentist said the price, and I said to her, get up and leave. Don't feel you're trapped. And see, as animals, we go into a sympathetic response. So we lay on our back, and the dentist is over us.
Right.
Primarily, it's like we're threatened. So it's a big deal who you go to.
And get second opinions, by all means,
Mm-hmm.
I
And
think that's important too.
And we want quality for our money, too. We want the quality.
Absolutely.
Yes, and quality and caring, and you never want to feel they're rushing through your procedure. That's the other thing is you want to know that they're. I talked to a dentist in Florida. His father was a dentist, and he said to me, a lot of times you can even not know what's happening. And I thought about that, because dentistry is one of the few things where it's all hidden. Like, how would we know?
Correct.
So
exactly, you don't know until you
ask questions, and if the staff don't let the staff put you off. Make sure you get your questions answered.
Yes, very important.
When you go to the next dentist and they say, "Oh, you had some bad work there,"
right?
or when you're in
there was
pain.
something left in my mouth. There was something left on my mouth for the last 2 years, and the guy said to me, "Oh, they didn't finish this." So yes.
Oh, how sad is that? Well, thank you very much, and I appreciate it. And this was really quite fun.
Thank you.
Thank you so much for having us.
Oh, it's a pleasure. And we'll be back next week. Thank you again for listening. I know you got some wonderful information, and we'll see you next week. Bye-bye.